Yesterday at Doug Ford's news conference, he expressed his frustration with the amount of tests that have been going on in Ontario. I've been talking about this, about the backlog of tests, particularly here locally, because the numbers don't add up, and I've gone through that in other segments. You can go back and watch those segments if you want for more information on how the Algoma numbers are not matching up with the Ontario government's numbers in terms of the amount of tests being done. But Doug Ford yesterday expressed his frustration because we have the capacity to do 13,000 tests a day, and we're not doing that. We're doing 2,000 to 3,000 tests a day. A couple days they were over that in terms of the amount of tests they did, because there was a backlog, as I mentioned last week, of 11,000 tests. That backlog has more or less been cleared. Now, Doug Ford has said he wants not only the testing done to people who present with COVID-19 symptoms at assessment centers, and he wants it to be now everyone who works in long-term care homes. He wants them to be tested. He wants the police tested, the fire department tested, paramedics tested, and also nurses and doctors and any other front care line workers. And what Doug Ford is saying here is that we now have the capacity to do 13,000 tests, and there's no excuse not to be doing 13,000 tests per day. I want to say that is a very good thing that Doug Ford is pushing. He's done very, very well in helping to manage this pandemic here in Ontario, and his frustration of not being able to do those full 13,000 tests per day, I'm very glad that he expressed his frustration yesterday at the mic and said, look, we need to be doing these tests. We have the capacity, and there's no excuse for not getting those tests done. Because if you look at what has happened at some of our nursing homes, the virus has spread rapidly, both through the staff and through the patients. It's also happened in jails. It's also happening in homeless shelters as well. And this weekend is Easter weekend. Easter weekend, we normally get together with our family and sometimes our friends as well to celebrate Easter and get together, have a meal, and enjoy a long weekend together with family and friends. However, that is not a good idea. We have been social distancing now and staying at home for several weeks. We have seen, as I covered in the first segment, how our numbers compare to other countries, including the US, and our numbers are fantastic comparing us to other countries on the planet right now in terms of actually containing COVID-19, and I'd like to thank both Trudeau and Ford for that. But I want to use an example. Some of you, if you watch TV, will know of a jail in the States called Cook County Jail. It's basically in Chicago. It's one of the largest jails in the US. 2 weeks ago, 2 people tested positive for COVID-19, and they were immediately isolated from the rest of the prison population. 2 weeks later, they have 350 cases of COVID-19. They only have 4,500 inmates. So even though they were able to test those inmates, they quarantined them immediately, and they've been in self-isolation, they have not been able to stop the spread through the jails. And it has spread like wildfire. So I want to give you a little idea of where it is for them in terms of what has happened in 2 weeks. So they went from 2 inmates having the coronavirus, and 2 weeks later, they have 17 people in hospital, and already 1 person has died because of the coronavirus in the Cook County jail system. In other jail systems, for example, the US-wide, they have 1,324 cases and 32 deaths already related to coronavirus in the jails. Now, I want to compare being in jail to sitting down at a table with your family for Easter dinner. I'm not saying that it's, spending time with your family is the same as being in jail, but you are in close contact, just like someone is in a jail cell. You're going to sit next to someone at the dinner table who is not going to be 6 feet away from you. You're going to sit in your living room, and the person's going to be sitting next to you on the couch or on the chair right next to you, not 6 feet apart. This is a perfect example of if someone has COVID-19 and goes to a family gathering where there's, let's say there's 12, 15, 20 people, one person, all it takes is one of those people to be carrying COVID-19 to spread it to everybody else. And we know that family is over generations. In other words, when you do a family gathering, there's people of all ages there, probably from little children and possibly even babies, all the way up to people in their 70s, 80s, and 90s. And we know that people in their 70s and 80s, that the death rate for them is very, very, very high. We need to not see our families this Easter weekend. I would love to go visit my parents and have Easter dinner with them, but they're both elderly, and I don't want to expose them to the possibility that I could be carrying the coronavirus and not even know it. So please listen to the OPP this weekend who have said stay home. Please listen to the local public health unit and also the Ontario and federal governments when they're asking you to stay home. So please stay home. I'm Chris Oldcorn, and we'll be right back.